So we're advanced by 1 hour.
Yes.
The
Philippines, 1 hour ahead.
We are 1 hour ahead of you. So I am Dr. Myra Oruga. I'm the assistant to the Vice Chancellor for Academic Affairs, Research and Publication at UP Open University. We are the 5th constituent of the UP system. I am the program chair at the same time of Diploma in Master of International Health. My expertise is clinical public health nutrition, and Doc Lily is my classmate in the RPH at UP Manila. Okay, we've been through a lot of things when Doc Lily is here in the Philippines. So I hope to share with you a video. I think I had given this video with to Lily before. However, I'm going to flash it out. I'm not really sure if the audio is okay. Okay. Otherwise, I'll ask Lily to let them flash the video through your end. Okay. So let me share with you. Host disabled and screen sharing.
Oh, wait.
Can you allow me to share the
sure.
share screen? So it's a little bit hazy here in the Philippines. It's raining since yesterday. So it's we call it bad weather. Although because of the pandemic, we all are work from home. So I've been at work from home since June, I think, since the lockdown of the Philippines. And we have the longest lockdown all over amongst country around the world. So we have the longest lockdown. Anyway. Okay, so can I share now? Okay.
Yes, please.
Okay, so this is a presentation which I prepared before, and I submitted this to Lily. Okay.
No audio.
Could you maybe add the audio to be shared?
Hello, Doc Myra. Would you please to share the audio?
Come again? Can you hear the audio?
No, not yet. Not yet.
Okay, wait. Can I send it to Ryan?
Oh,
so
sure.
She will be the one sharing it to everyone?
Sure, yeah.
I'll send it. Kindly send your email through the chat box. I'll stop share.
Cool.
Okay, wait. I'll stop share and I'll ask you to share it because I'm having problem really with
the audio.
Wait, I'm going to share. Can you send me your email ad so I can share it with you? So you will be the one flashing it.
I think I've already got it from Bu Laili. Yeah, I've already got the the copy from Doc Laili.
You got it?
Yeah.
Okay, so can you please assist me in sharing it?
Yeah, sure.
So everyone is from home, studying from home live?
Yeah.
Okay. Except Ryan, who is in, I think that's an office.
No, this is just the background.
Okay, just like me, it's just a background. Okay.
Yeah. So here is the share the audio. Step right. Okay, thank you, Dr. Myra, for providing us with the video presentation. We move to the next agenda or the next discussion. So we will give you, for the student, I will give you the permission to speak. Please, if you're ready, please raise your hand first, and then I will choose who will asking the question to Dr. Myra first. Yeah, please. Silakan bagi yang sudah siap. Who will be the first person to asking?
Yes. So that's how we do. Before I answer that, okay. That's how we do lectures right now with the new normal at UPOU. Usually we do presentations like that, less of a talk, but more of the visuals because based on our study, students are more visual right now rather than more on the PowerPoint. Okay, so that's how we do it usually at UPOU.
Okay.
Silankan ajukan pertanyaan.
Yeah, sorry. I use bahasa Indonesia.
Yeah.
It means the student can ask a question. Yeah. Don't worry about the language. I guess if you have a question, please raise your hand, and I will help you to asking the question. Yeah.
Kang Ryan, there is several students who I already listed to be address the questions. One is Desi Adityani,
Okay.
Revita Nur Istiqomah. Maybe you can call her.
Yeah, sure. Yeah, Desi Adityani. You can ask the question first, and then yeah, please, Desi. Silakan, Desi.
Yes, ma'am. My name is Desi. I want to ask you something. Is education and health promotion in the Philippines, especially at this time, regarding the use of masks of prevent COVID-19 transmission? Can the community be well accepted or not? How does it compare to Indonesia? Then what steps have been taken in health education and promotion, and how effective have these steps been implemented in the Philippines? Thank you.
Okay, so about the thank you, Desi. So this is about the acceptance of mask,
Wearing of mask.
using mask. Yeah. Okay. Yeah, and then how
for your
about this
first question, yeah, okay. For your first question, initially, okay, really the wearing of mask, social distancing, as well as wearing of face shield is not a culture in the Philippines. It's not bound to the behavior of the Filipino people. So we have having hard time convincing them. But because of the massive um, creation of a health promotion materials posted in a social media platform. Say, for example, Philippines is a social media capital in the world, right? We are so active in social media. That's why we identified that this is the platform that would be very effective in conveying the message to the target, to the Filipino people. So first, there was a massive implementation of health promotion material to be posted on the social media, be it on a Twitter, Facebook, and Instagram, but more on the Facebook, because most Filipino people, especially those at the marginalized group, we call that marginalized group, those who are at the at a certain economic, not really below economic poverty, but those who are those masses, we call it, utilizes Facebook. So we place it there, and then also with the coordination at the community level, barangay level in our country, of a massive information about wearing of mask, face shield, as well as social distancing. Gradually, okay, the effect of slowly low cases, slowly decreasing cases of COVID-19 here in the Philippines is being felt, okay, especially right now. Before, we have more than 3,000 to 5,000 cases a day. Right now, it's been decreasing to 2,000 plus to 1,000 plus only cases per day. Meaning, the effectivity of the health promotion and education materials is now being absorbed by the Filipino people. Plus, in terms of policy, okay, we have stricter policy right now on wearing face shield, face mask, and social distancing on a crowded places. Say, for example, in the grocery, you cannot just go into the supermarket or grocery without wearing the face shield or face mask, or face shield and face mask. It has to be worn both. As well as we have asked the community leaders, barangay and municipality, that um, every supermarkets or every commercial establishment should place a warning sign as part of the health promotion material, okay, informing the public how they would be acquiring COVID-19 without that wearing of mask, plus the stricter policy. Okay. Also, we have regulated the coming in and out of teenagers, those vulnerable groups, 21 and below, they cannot go. Uh, 18 and below, I mean, 18 and below people cannot just enter the supermarkets or groceries or any establishment for that matter who has a who where crowded people usually come. Okay. Also, senior citizens are prohibited from going out of the house. So that's how we manage right now in terms of the prevention and with the help of the health promotion and education material. So there should be really a massive campaign as part of the information. That health and education promotion campaign, like I said, is all now translated to a regional dialect, since we have a lot of languages in the Philippines, okay? Not only Filipino language, we have Tagalog, Visayas, etc. So it has been translated so that people could understand, okay, the message that health promotion and education materials is conveying. Also, there should be really a stricter policy. So the implementers of that policy should also be strict. So that's what the community have been doing right now. The activeness, okay, of the municipal level, okay, especially we call our leaders in every municipality mayor. So with their ordinances and with their penalties amongst those who do not follow the rules against COVID-19 protocols, then they will be fined. So gradually we are already adapting to the situation, especially on the several ordinances that the government has been trying to implement. Of course, that ordinances came from the IATF, the Technical Working Group, okay, of the against COVID-19 pandemic in the Philippines. So we have our own technical working group, IATF. They have several functions and deliverables pertaining to COVID-19. So that's it. Really, it's really advocacy at the community level. So I think that that's how we are doing right now, and it seems effective since in terms of translation to the number of cases, it's gradually been decreasing so far. And we are hoping really that by the end of December, uh, the target of the epidemiologists in terms of their projection, we would be only having 500 cases a day. Of course, it cannot be, we cannot compare our country to other countries, say for example, Korea or Japan or Taiwan or Thailand, okay? Because we have 1 billion people in terms of population. Uh, so that's it. So I think it's really the advocacy, the empowerment driven of every key leaders, as well as the behavioral change of the Filipino people. So really behavioral change cannot be in one snap. Okay, you cannot translate it overnight. So it's really gradual. However, we are glad that the behavior change right now amongst the Filipino is gradually changing in just a span of months. Usually, behavior change can be measured by 3 years or 5 years, right? So, uh, the awareness have been increasing because of the massive campaign. Even some non-government organizations, say for example, private companies, have been helping in the massive campaign on wearing mask, on wearing face shield, as well as social distancing. Also, we have minimized already the coming ins and outs of the people in the establishment. Only 50% can enter, say for example, a fast food establishments. So that's it. And just like I've said in the beginning, we are the only country who has highest, longest uh, GCQ quarantine period in the around the globe, I think. But it's becoming very effective. So we are amendable to that because we wanted to not really eliminate. We really wanted to prevent the widespread and increase of the number of cases. So I hope I answered your question.
Yeah, I think it's we have a lot of information from you. Yeah, including the support or
Yes.
and also the key leader that or the stakeholder that really help to empower the health promotion. Yeah. Okay. Thank you, Myra. Maybe we go to the next question. Yeah. Please, Revita. I will unmute. Yeah, please, Revita. Yeah.
Hello, ma'am.
Hello.
My name is Repita Nur Istiqomah Muslim.
Morning.
I want morning. I want to ask, what is the no, how is the process of health policy making in the Philippines, and how public health and government collaborate in terms of making health policies. Thank you so much.
So in terms of health policy, okay, before making a policy, there should be an evidence-based research, okay, to prove that indeed a certain health policy is needed. Okay, so what the Philippine government does is they commissioned, okay, private and or academic agencies. Say for example, at UP, we are commissioned by the Philippine government to do an evidence-based research on the need to create a certain policy, specifically health policy or other policy for that matters. Uh, After that, okay, how do you call that? Government politicians sometimes would ask us, okay, the results of the data or the data that we have collected, and they use that, okay, to make that certain policy. Also, they include us, okay, as a member of the technical working group, okay, to oversee how the policies is being done. Say, for example, in the cancer control program, okay, there is a technical working group at the Department of Health, okay, helping out craft, okay, that policy. So that after crafting that policy, the Department of Health would endorse it to a certain government official to have a fund for that. So it should be supported, of course, by a government official. So it will be presented, say for example, in a Congress hearing, okay, on a health sector committee, and then that's it. They will scrutinize, okay, every steps of the policy, and then afterwards, they will vote if that policy would be approved, okay, and then moving forward, they will create a Republic Act out of it, and then it will be implemented. However, before the implementation, an IRR or implementing rules and regulation guidelines should be heard of. So, how is the process? Okay, every non-government or government agencies for that matter involved into that kind of policy, say for example, will be called up. They will gather as a group, and then they will say their uh, what do you call that, comment on that policy. And then they will craft the implementing rules and guidelines for that, and then after that, a policy is created. So once the policy is created, whoever is the mandate of that policy will implement it. Say for example, in our case, in at UPOU, we are mandated to support non-government, government agency, interagency on under RA Republic Act 10 650 on the e-learning act. Okay, so we are the head agency to support other government agency or non-government agency, public and private schools to assist them on online learning. So we are bound as part of our deliverables to teach them how to do it online. Say for example, if it's a health policy, if it's a cancer control program, then that as the bureau of the Department of Health who is handling that will cascade that down the line to the municipality, barangay health offices, and regional, national level, regional level, municipal level. So that's how we craft. It's always should be supported by an evidence-based research. So we do primary survey data collection before crafting a health policy. So it has to undergo certain steps and certain processes, okay, in order to establish that health policy. What about during pandemic? Do we have? No, this is a special case. So the president of the Philippines is mandated to create a committee, okay, that would oversee, especially during emergencies. So that's part of the law in the Philippines. Okay, in the event that there is an emergency, the the president of the Philippines is bound to create a technical working group. Okay, he is allowed to create a technical working group that would oversee. And you will ask, after the time of COVID, what will happen after the time of the pandemic? Okay, that technical working group will report then, and then they will be creating again a technical working group that would create now that health policy using the data that has been collected during the pandemic. So there are a lot of committees working together. That's why sometimes communication is a problem because there are a lot of people who are involved, right? Except if there are few of them. However, we have been saying that two heads are better than one, right? More opinions, uh, uh, more things that we would be realizing, specifically the weaknesses of a certain uh, what do you call that, or certain policy that is supposed to be implemented. So that's how it works. Sometimes it's too tedious, sometimes it's too long. Okay.
Mm.
However, it's just that we do not want to perfect. There is no perfect policy,
Mm.
right? There is no perfect policy. It always need to be amended through time. We have to um, flow with the tides of the wave, right? Okay, flow with the tides of the wave. We have to sway with them in time. So now that the technology, advancement of technology is the new normal right now that we are adapting, then we also have to adapt to that policy. Okay, sometimes old policies, are not applicable anymore to the changing times. That's why we always have to amend it. But that's how the process is. Okay.
Okay.
I hope
Yeah.
I have answered your question. Again, research has something to do with it.
Mm, mm, mm.
The big bulk really of supporting a certain move, be it a policy, health policy, or a certain ordinances, it has to be an evidence based,
Mm.
and research is the driving force is plays a key role on that. Okay,
Okay. Yeah.
I hope
Okay.
I have answered your question.
Yeah. Is that clear? Is it Revita? Is that clear? Yeah. So I think it's kind of a long journey of policy making
Yes.
process, but it's when it's evidence based is really based on the correct data, and we can have a responsible with the result. And yeah,
Yeah.
okay. I think we can move to next question from Iza. Iza, Damar Iza. Yeah, Damar Irza. Yeah.
Okay. Good morning, doctor, and good morning,
Yes. Good morning.
Dorian and Mrs. Uh, Let me introduce myself first. My name is Damar. My student's ID is 55. I'm sorry because my English just a little bit so bad because
It's okay. It's okay.
I don't usually use that language. Okay, doctor, I want to ask you something. In your opinion, is there a way to increase the effectiveness of health education and promotion measures in community? Because in my opinion, it seems that education and health promotion are still ineffective, especially in Indonesia, seeing that the government is having difficulty in carrying out health education and promotion to the public in this COVID-19 case. So that until now, the increase of COVID-19 cases is still happening. And on average, people are still more concerned with economic factors than their own health. I think that's the question.
uh, is there a way to increase? What do you mean?
The effectiveness, I guess. The
Hi,
effectiveness. Yeah.
The effectiveness of health promotion and
Yeah.
education.
Yeah.
Uh, Okay. So how do I answer that? Because
May-
in our country, okay, really empowerment is the key towards an effective health promotion and education campaign. The we have to target the community level, and the community leaders should be empowered and should be part of their advocacy. If it's not, it would really be not effective. Okay, it's just that we have to have high persuasion character. Okay, because health education and promotion targets behavior, and it's really hard to measure behavioral change. Okay, good thing that behavior change can be measured right now during pandemic as to the number of cases, but we we do not know if it does really. Okay, it's a matter of compliance of the people. Okay, number two, you should know their very reason why they are not why it is not effective. Okay, you have to consider several factors, just like the ecological framework. Okay, you have to adapt the ecological framework. The ecological framework, which I am adapting right now as an expert, I consider several variables. Okay, to answer certain behavior change. Say, for example, is it political? Is it economical? Is it is it really behavior? Is it the influence of the environment? So you have to consider that. Okay. Um, so that's it. It's a matter of compliance in terms of the person itself. The person should be empowered. In the Philippines, in the beginning, it's not like that. Okay. However, because of the driving force, okay, of the local government unit. Say, for example, the mayor of Manila, the mayor of Pasig, if you have been active on Facebook and you wanted to browse, okay, they have really been active. The visibility of the leader, okay, should be there for the health education and promotion campaign to be effective. In the Philippines, for instance, those at the community level believed on their barangay leaders. Okay? That's why the persuasion of the Philippine government is targeted to those LGUs, as well as there should be reward. There really should be a reward system. In our barangay, okay, there is really a reward system. If the number of cases is decreased, there an addition to their fund, government fund for that matter, circulating into that barangay is increased also. Okay? So that's part of the persuasion, and that's part of empowering the LGU. It's like a gratitude for the good job well done. So that's how should I think that's how it should be done for it to be effective. It could be ethically, in terms of ethics, okay, uh, when we see it, it is not really good in our perception. However, it maximizes, okay, the potentiality as well as the empowerment of uh, that leader. So it boosts the morale also of the uh, very hardworking barangay leaders. Also, apart from the reward, monetary reward, there should be an acknowledgement. Okay, acknowledgement among the to the barangay. Say for example, in let's not go to COVID, but to TB dots here in the Philippines. Okay, we all know that tuberculosis is a big problem here in the Philippines. However, uh, in terms of reward system, okay, if the a certain municipality have a zero case of tuberculosis, they are rewarded, they are awarded, they are recognized. Okay, that recognition increases the efficiency of the barangay leaders, which increases the efficiency to do the groundwork. Okay, when they do the groundwork, really the people would follow and they would believe. I have witnessed that. And so therefore, I say that the reward system amongst those who are working hard in that should be commended. They should be commended. Okay. So I think that's it. So health promotion and education campaign alone, okay, cannot do that behavior change. Okay, it should involve people, leaders, people who are leading the barangay, and really, the most effective is the community. Okay, you have to target the community. So I hope I have answered your question, and I hope also it is best to uh, review best practices. You have to see best practices among other countries. There should be you should compare how they are doing it and how not they are doing it. Okay, say for example, the Philippines pattern, right, is pattering is always seeing the other side of the opinion of other people who did their best, okay, to prevent cases of increase in COVID-19. Say for example, Taiwan, what did they do? Okay, why did why do they have less cases? Okay, so you try to analyze their best practices and you adapt it to your community, at the community. I always say it's a community because that's the most effective ones, because they are the most vulnerable, okay, to be infected by the disease. That's why you really have to target them. And uh, yeah, there should be high advocacy amongst us. Okay.
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 So,
I
so
hope I've answered your question.
yeah,
Based on
maybe I try to elaborate about the economic problem that Damar asked before, because what really happened in our community is that when people were asked to wearing a mask, they complaining about the
vacancy.
the economic factor because we are struggling to buying food. How come we can uh, buy the masks? Yeah, so it's economic. So how about that?
Okay. In the Philippines, we innovate. Okay, we innovate. We the barangay level teach them out of the available resources. Say for example, they don't have. Otherwise, we supply them. Okay, that's the government mandate. In fairness to the Philippine government, we supply them actually, and then we teach them how to innovate. And so the innovations, okay, it helps. Say for example, you have uh, a usual demonstration is being done at the barangay level. If you have a piece of, say for example, a cloth that is not being used, okay, you can use that as mask, okay, when going out of their house. It's only out of their house. Also, we have really strict implementation. If you don't wear mask, you will be fined. So that's the idea. However, you have to innovate and teach them how to innovate. Say for example, a small tissue paper would outdo without their, but you have to explain to them that this is just a one time wearing. Okay, after wearing it, you have to dispose it off properly. So it's a matter of innovations amongst with the help of course, of the barangay leaders or the community leaders. So that's it. And it's really hard work to convince them. Really, there are a lot of people who are very, very stubborn, right? Right.
Yeah, yeah, yeah.
Really to wear
It is.
because they really do not understand the effect of that COVID-19, because in the beginning their perception is that it's just an ordinary flu. Okay, until they contracted the disease. Okay, until they cannot breathe anymore. Okay, until a relative have experienced to have COVID and then later on died. That's how they would the realization would come in. Okay, if something happens to their relative or to their loved ones, that's the only realization that they would be following through the rule. Okay.
Yeah. Okay. Yeah. Thank you for the answer, Myra. And we go to the next question. Yeah.
Thank you also, Damar.
Yeah, it is. Next question is Nur Aulia. You can unmute. Yeah, Nur Aulia, please.
Okay, yeah.
Yeah.
Yeah. Excuse me, I'm Nurul Yagnia. Before I ask question, I want to say sorry for my grammar mistakes.
Okay.
Can you start the video?
Sorry for a low connection.
Oh, okay. Yeah, it's okay.
Okay. We know that in my country or maybe in Philippines too, there's many people have been promoted and educated the negative effect of smoking or tobacco use. But until now, there are still many people smoking and doesn't care about the warning that we've already told before. So, what if the health promotion that we have been provided doesn't have a significant impact to behavior change in society? And what are the next steps that we can do to solve this problem if the health promotion doesn't work effectively? Thank you.
Okay.
Okay, it's
So
about
yeah, we have
smoke
to
and tobacco.
smoking and
Yeah.
tobacco. Okay.
Yeah.
We have to review the tobacco control program. This has been advocated by WHO, right? There is a working group on the created by the World Health Organization on tobacco control program. They have several provisions there that should be adopted by a certain government. Okay, by the government on the tobacco use. Okay, so it's a matter of regulations actually. Okay, of a certain country. In the Philippines, okay, uh, uh, it comes to a higher level already, because if we targeted behavior change of quitting tobacco, even if you place a scary figure on the cigarette box. Have you seen that? Okay. Smokers will not comply. However, with the big taxes, okay, that is being implemented right now, as well as the alcohol is connected with tobacco control program. Okay, we implement a big tax on alcohol and cigarette products. Okay, it's becoming more effective because one stick of cigarette costs right now in the Philippines $5, $5 USD, one stick only. Okay, there are 10 sticks inside the pack, right? So if you multiply it, that's approximately $50. That's 2,500 pesos.
Oh.
Okay, so
Wow.
stricter, yeah. So
Really
it's very
expensive.
expensive, yes. And so therefore, those who are smoking were obliged already not to smoke because it is very expensive. Okay, so that's if we would rely only on health education and promotion campaign, really it would not be effective. However, policy, okay, stricter policy right now of the Philippine government does the regulation of smoking ban in the Philippines. Of course, there are others who are still smoking, but we already minimized it. Okay, so big part there is the regulations of the law, okay, being implemented by the Philippine government. Plus, our president is angry to smokers. So that's an advantage to us. Compared before, he is a smoker. Our previous president is a smoker.
Mm.
So the regulations is very lax. Okay? But right now, our president really hates smoking. That's why there is a big impact, okay, on smoking ban in the Philippines. Plus, it's really very expensive. Imagine you have to spend 2,500 pesos just one pack.
Mm,
Okay,
mm, mm,
it
mm.
can buy several goods for your basic needs, right?
Yeah, yeah.
So that's it.
Okay.
So an evidence-based research on health promotion in terms of knowledge, attitude, practices, translate what is translated there. So perhaps they had increased the cost of cigarette because of the KAP that they had done among smokers. And active, there is an active group groups, non-government organizations supporting the smoking ban in the Philippines. So that also helps. So we cannot only rely on the government itself, but also it should be helped by the non-government agencies and private companies as well.
Okay. Thank you very much.
Thank
Yeah,
you.
it's interesting when we also thinking about how to change the behavior of the community on, especially on smoking and tobacco use. As you mentioned before, that it's not about changing the directly in the lower level to the person itself, yeah, or to the community itself. So it becomes it belongs to the higher level. Uh, so we use the policy and economy by increasing the tax. Yeah. Okay.
Yeah.
Thank you. We move to the next question. Yeah. Fitri,
Thank you also Nuralia.
Nuralia. Yeah.
Yeah. For your
Okay.
question.
Fitri, you can ask the question.
Yes, thank you, Parian.
Yeah.
Hello, Doctor. My name is Andi Fitri Ramadhani. I want to ask how healthcare works in Philippines overcome citizens that already education about COVID-19 but still ignores health protocols, which is contribute to risk in COVID-19 case. Thank you, doctor.
Can you help me translate that, Ryan?
Ya, jadi maksudnya Andi Fitri yang sudah ini ya, yang sudah di apa? Bisa diulang lagi?
Health workers, health providers, how
Oh,
to
okay.
with health care or health providers who didn't willing to strict
Obey the
health protocols.
Yeah.
Those health providers who
Thank you
are
for that.
not complying to health protocols. Am I right?
Yeah.
What about that?
Yes.
Okay.
Yeah.
So there are a lot. That's part of our that's part of my recent study, the ongoing study on the knowledge, attitude, and practices of uh, uh, healthcare workers on COVID-19. Of course, we are human, okay? Even if there are they are health workers, okay? They feel the same way as we do, okay? They have also uneasiness. Say, for example, of wearing mask, okay? Say, for example, of wearing PPEs, but they are obliged if they are into the area. That's why we wanted to explore on that, and then KAP. Perhaps it's really, on my perception, it's not really the knowledge. They have enough knowledge on COVID-19. However, the attitudes and practices, as I may say, there is a cultural factor. A cultural factor has something to do with it. Specifically, I think on the religious affiliations, okay, on their beliefs, okay, on their practices. I still don't have an answer to that. However, because we are human and are bounded to several fears, as well as because we know already the protocols, perhaps what they believe is that they would not be contracted with with that disease. So we wanted to explore with that study, and I hope to collaborate with Laili also, among health workers there in Indonesia, if it does have similarities with the Philippine government, that with the Filipino health workers. Okay, there are some also who do not comply. Say for example, in the Philippines, every 2 weeks, if you are a health worker working in the hospital, it's part of the protocol that you do COVID-19 testing, the RT-PCR. It's not the rapid test, okay? It's the recombinant transfer PCR test, okay? That we does. Okay, so some of them do not want to comply. Perhaps they are afraid also that they might have contracted disease asymptomatically. Okay, so that's it. Every 14 days, and then after swabbing, they have to stay into their quarantine area, quarantine facilities for another 14 days. So it has to be 28 days of quarantine before they can meet and be with their family also. Okay, be with their family again. So perhaps the compliance is low because they don't. We really don't know because they wanted really to see their families after 2 weeks of being in the hospital. Perhaps that is the reason why such behavior, such low level of compliance is. We really don't know. I still have don't answer. I still am exploring the answers to that. But perhaps that would be one of the reasons. Imagine 28 days without physical contact with the family, only video calls. Okay, and then after that, after 28 days, that's the only time that they will be able to meet their family. That holds true for those working at the municipal health offices as well as specifically in the hospital, most especially if they are working in a public hospital. That's the protocol. So, or even in the private hospital, they have a quarantine area already. So perhaps that's the low level of compliance is the reason like that, and that's why they don't want uh, to submit themselves to uh, uh, further test to COVID-19. Yung absence of the family physical contact perhaps would maybe the reason. Okay, so I'll let you know if after perhaps 3 months of interview with them, I'll let you know. I'll share with you the result of the inquiry. Okay.
Hmm. Okay. So it's still running, yeah? You still running the evaluation or the
Yes,
research about that, yeah?
the survey we are still running,
Yeah.
and we're having hard time because what we do is it's not really right to do the proposal, but it should be random. But it's very hard right now. We have very strict policy on ethical policy on conducting research in the light of COVID-19. So what we do only with my project assistant is that we just do the online interview with them. So I'll share with you what will be what would transpire into that study. It's the KAP of the health workers
Okay.
on COVID-19 protocols. My student also, a master student who are soldiers, medical health, uh, um, government medical workers who are working in the uh, what do you call that? Who are soldiers, are working on factors affecting the COVID-19 protocols among the men in uniform. So because we also have high cases among soldiers, so we wanted to know the level of compliance to the protocol also. So we could parallel that out. I asked three of my master students to work on it. So we will be sharing with you if, with the pleasure of Lily, I can invite them
Mm.
to share with you their results of the study. So it has a policy impact among on the, we call that PNPA personnel, Philippine National Police Academy personnels. Okay, they are soldiers, but they are health workers.
Okay.
We're exploring on the protocols on
Yeah.
COVID-19.
Maybe I can highlight the answer that it is quite a unique phenomena that the health workers has already good knowledge. So maybe the students is also still learning about the concept, Myra. So I will a little bit explaining the concept. So what Myra said that it is strange when health workers has already know the knowledge, and then we usually move to intervene the attitude, and then we also try to intervene about the what we call it, psychomotor, yeah, so key AP, yeah. And then if there's is still a problem, so we move to the next factor, which is for example religion and also belief, and it still has what is it, bad or low compliance. So Myra still working on the survey on how to on why this still was it low compliance in the health worker to obey the rules. I think it is clear, yeah, for yeah. I think we can move to the next question. Please, Salsabila Nabila, to yeah. Okay, thank you, Fitri. Salsabila. Yeah.
Okay, thank you for the opportunity. Good morning, Dr. Myra.
Yes.
My name is Salsabila Nabila. You can call me Sabil. Recently, I have been interested in nutrition problems in toddlers, and I have some question for you about health education and promotion on the fulfillment on toddlers nutrition. Seeing the high rate of malnutrition among toddlers in three Southeast Asian countries, including Philippines, Indonesia, and Malaysia, an average of 40% of toddlers suffer from malnutrition. And my question is, how is the implementation of health education and promotion to the people of the Philippines, especially for pregnant women and breastfeeding mothers, which is greatly affect the provision of child nutrition? And is there a special health program for the prevention of malnutrition in toddler in the Philippines, and how effective are the health programs provided in overcoming the problem of malnutrition among toddlers in Philippines? Thank you.
Okay. Thank you,
Okay.
Salsabila. Okay. When we talk about malnutrition, it's only not low birth weight, but overweight. Okay. Low birth weight and overweight children, obesity. Okay. When we talk about malnutrition, that's the kind of category right now of in the Philippines, particularly specifically the FNRI, Food and Nutrition Research Institute. So they are the working institution who focused on the nutrition of the Filipino people. So among toddlers, there are several programs in the Philippines. Number one, okay, we always say from womb to tomb, right? In terms of nutrition uh, of a certain person from womb to tomb. So there are several supplementations being given among mothers. Also, there is a high advocacy of breastfeeding in the Philippines. Okay, specifically, there is health promotion and education at the barangay level on the importance of breastfeeding among among pregnant women. Okay, so that they will have high awareness of the importance of breastfeeding to their child. Okay. Next, we have certain regulation and policy on the consumptions of several food products. Okay. Again, like in tobacco, we have high taxes on sodas, and we do not encourage sodas being sold out uh, in school. Okay. And there is a strict implementation in among public and private hospitals. If you gave birth, it should be breastfeeding only. Okay? No matter if there is no milk or breast milk that is being expelled in you, it should be breastfeeding. How is that so? Okay, some government hospitals supports private hospitals because there is a what we call milk bank, okay, program. Okay, that we do have in every public hospitals, especially public hospitals being run by the retained by the Department of Health. So say for example in PGH there is a milk bank there that mothers who have lack of milk during their after giving birth can ask for that milk. However, really there is a big advocacy among the nurses plays an important role here. Okay, on health education and promotion. So every mother who gave birth naturally and or be it a cesarean section would undergo seminar before they leave, okay, the hospital. Also, if they there is a regulation right now on giving birth here in the Philippines. Okay, so there is no more advocacy of giving birth at home. Instead, they had to give birth in a facility, or if they would be giving birth at home, a trained birth attendant should be present who can assist them and who can explain to them the importance of breastfeeding. They will not leave your area or your home unless otherwise you expel the breast milk. Or if there is lack of expulsion of the breast milk, you will be taught how to. Say, for example, certain protocols on how to increase your breast milk. And or they will assist you to go to a milk bank uh, to acquire a free uh, breast milk. There is a regulation that you have to replace it. If you acquire that breast milk, you have to replace it once you have already once you are already producing your own milk. Okay, so they do not allow, there is no rule to them that you will not be producing your milk. It should, you will be producing your milk. So that's the empowerment of every trained TBH or trained barangay hilot in our, we call that trained barangay hilot. Hilot means what? Massage. Okay, they are trained how to assist in on the on birth delivery. Okay, among toddlers, we do not encourage anymore them, specifically mothers, to feed them with noodles. Okay, You know noodles, pack noodles. Okay, there is a big regulation right now in the Philippines. Also, pharmaceutical companies producing milk are not allowed to talk or sponsor any physicians, for that matter, to promote their canned milk. Okay, so they are not allowed in the hospital. They are not allowed to contact pediatrician, for that matter, to promote their canned produced milk. Okay, canned produced milk are allowed only after 6 months of birth, but this is mostly discouraged. If It is mostly discouraged, actually. I have experienced that with my niece right now. So he's a what do you call that? Fully breastfed until age 1 years old. And until now, she's still breastfeeding because the mother is still producing the milk. And lo and behold, he's not been contracted with any disease. Okay? He doesn't have any colds or cough or anything. So that's the beauty of breastfed children. There are a lot of policies to us, okay, being implemented, and the implementing agency is the FNRI, who monitors also, okay, the nutrition of the toddler. So there is the nutrition group, the nutrition agency is very much active in that advocacy. What else? What about obesity? So that's again our problem. Okay, there are a lot of fat kids. We always say that fat kids are cute, but they are not actually, because if you are obese, when you are a toddler, you have a risk of developing diabetes at the age of 25 years old. Okay, so we discourage that. Um, Schools right now, we have a lot of health programs. Number one is that the regulations of selling dried chips, preserved chips, that is not allowed anymore in school, as well as those soda drinks, they are not allowed anymore. So the only one that is allowed are natural fruit juices to be served among uh, those toddlers 3 years old, because 3 years old can already go to a toddler school, right? So that's it. That's the program we have. What else do we have? There is a continuous monitoring being done by FNRI on the I forgot their program, OPT. How do I say that? We call that Operation Timbang. We regularly monitors the weight of the children. Okay, they regularly monitors the weight of the children, usually quarterly, and they have developed a survey form actually among caregivers and mothers, okay, on the importance of good nutrition to given to the to children. So that's it. That's the regulations we have, and
Sleep
that's how
apnea,
we
dysfunction in central respiratory control, mixed apnea, combination of obstructive and central sleep apneas.
Okay, so that's how we uh, monitors our nutrition among toddlers and children.
So OPT is the same as cadres. Is that cadre or worldwide
Yeah,
cadres in
yeah,
Indonesia?
yeah.
Yeah. Okay.
We call that Operation Timbang, OPT.
Hmm.
So usually toddlers at home, especially those who are 1 month and until 6 months, are being weighed regularly, quarterly, okay, to monitor their weight. Okay. Because we don't want really low birth weight. We try to eliminate low birth weight as well as obese children.
Okay.
Like they are cute, they are not cute.
Yeah. Okay, that's really interesting discussion, but I think we've already run out of time. Yeah, that's
There's still next time. Okay.
okay. Yeah, but we're really happy to have you again here, join with us in our next incoming webinar, probably. So we have larger students. Are you ready for that? But yeah, I think we've already have a lot of inspirational and also what we call it, a lot of and various intervention comparing to our country here. We've already talked about COVID-19 especially, and there were several other topics such as smoking and tobacco, and also what was about the nutrition in child. So yeah, there are a lot of new information for us, such as the breast milk bank. It's quite interesting. Yeah, we really what we call it. Yeah, but still. Maybe in terms of cultural, we have to really we have different what is it cultural and also religious what we call it factor, because in one religion to breastfeed the child still should be with their mother, something like that. So yeah, there's a lot of factor that affecting that. But I think it's interesting for us to study a lot based on uh, many intervention or maybe many health promotion program that you've already shared with us. Thank you very much, Dr. Myra. So yeah, I will. Maybe it's good for us to hear about you. Hear one more time from you for the closing statement, probably. Yeah, please.
Yeah, I'd like to yeah, Ryan, thank you so much for moderating this mahal kita daw. Thank you. Familia. Mahal din kita. Mahal means I love you. Okay? This is a very interesting interaction with the students of University Pajajaran. As always, I'd like to thank Laili, also my good friend. We've been through a lot in the Philippines. Okay, when she was here in the Philippines, so I'd like to, and then I cannot say no to her. If she requested something, I cannot say no. Even if I'm in the middle of the panel presentation, I had to ask the other panelists, the committee members, that I had to excuse myself because I have to be in attendance with the students of Lily. I'd like to, this is really very overwhelming. The 166 students who had listened to me. I hope you believe in what we've been saying. That's what we have been experiencing here in the Philippines, and I hope we had catch up something. You had catch up something to us on the several practices, specifically the importance of health promotion and education campaign. Just like I've been emphasizing, the big bottom line there to produce a good health policy is an evidence-based research, and I've been applying that through the use of KAP. That's the only way, as a health promotion and education expert, to prove something that we need to act upon on. Okay, so it's really a pleasure, and I hope I have imparted things with you. By the way, if you want to know more about the program of maternal and child health nutrition in the Philippines, we have several health promotion materials that is available online. We call that Unang Yakap. Okay, it's the advocate of mothers, leading on to the idea of breastfeeding. So it explains. It has a, I think, an English version. It explains the importance of the scent of the mother to the child, specifically on the procedures, okay, on how they will be able to grasp the nipple of the mother, and then recognize it and then suck it, and so on and so forth. So that's the process. Yes, that's it, Ryan. We have that. You can always watch that, and it's really this breastfeeding video. I share it also to my students in international health, particularly on the maternal and child nutrition. I'd like to thank Laili and Ryan again for inviting me, and I hope to see you again next time. I hope we could interact through a webinar, exchanges of researches among our students. There would be differences, there would be similarities. I know there are similarities among our cultures, so that would be interesting. And I hope that we could also finalize, Laili, our MOU with you and the University of Pajajaran. Our faculty at the college, at the nursing department, is very much willing to go there in Jakarta to meet you. So they are excited also. And we hope that you can also visit us one day after this pandemic.
For
We can
sure.
yeah, we
Yeah.
can host you in the Philippines and see the beauty of our country. Our place is at the back. That's UPOU. That's our oble. We have a different oble among other UP system. That's the difference. We have flag at the back compared to the other oble of the UP system. So thank you very much, Laili. Have a good afternoon to everyone. Have a good lunch. I
Yeah.
still have to go to the other room to check
Yeah. Okay. Yeah.
the
Thank you.
proposal is done.
Yeah.
So
Thank
thank
you,
you very
Myra.
much.
Yeah.
Yeah,
Thank you, Myra.
I'm
Yeah.
having a good time. We can have one picture.
Sure.
Okay.
Yes.
Sure.
Okay. Yeah.
We would have several of you on that. We hope I can request you to open your video,
Yeah.
okay, so
Yeah.
I can see the faces, the beautiful faces of Indonesian friends. Okay, so
Okay.
I'm so used to this because
Yeah,
we've been doing
yeah.
a lot of webinars with the lockdown.
Okay.
So
Mahasiswa diminta untuk membuka videonya karena
yes,
Dr. Myra mau ngambil gambarnya. Silakan.
Yeah.
Yeah.
yes. So on my count,
Okay.
usage on my count. 1, 2, 3, smile. Okay, so
Okay.
next one. We have 7 plates. Okay. On my count. 1, 2, 3, smile. We have another. The third one. Okay. Okay, we have 1, 2, 3, smile. Another one. We have a lot.
Many pages.
Yes. Okay. 1, 2, 3, smile. Another one. You have 7. Okay.
Yeah.
1, 2, 3, smile. Okay, last 2. So there are a lot of you. 1, 2, 3, smile. And then the last plate. 1, 2, 3, smile. Thank you so much, everyone.
Thank
I
you a
hope
lot.
to see you again, Ryan and
Yeah.
Laili,
Yeah,
face to
thank
Sure.
you.
face.
Yeah,
Yeah, thank you,
I
Lai.
will call you later.
Yes, I
Bye.
still have a 2 o'clock. Just
Yeah.
PM me. Okay.
Okay.
Dr. Sheila, do you know Dr. Sheila Bonito?
Yeah.
Yeah,
Sila.
yeah. He's at the other room. He's calling me already in the Viber. Come here already. I'm like, wait. I'm still talking to Lily. Okay,
Okay.
thank you
Yeah.
everyone. Thank you,
Yeah.
the University of Pajajaran. And I am a fan of a Korean. Sahamnida.
Samida.
Okay. Thank you, Myra.
Yeah.
Yeah. Yeah. Okay. Maybe there is a final statement atau dicukupkan saja, Bu Laili?
Ya, saya kira dicukupkan. Saya hanya menyampaikan kepada teman-teman mahasiswa bahwa hari ini kita mendapatkan pelajaran dalam pengertian berbagi pengalaman di negara yang lain, dan Anda tahu di mana perbedaan edukasi dan promosi, bahwa promosi itu artinya akan melibatkan masyarakat, melibatkan lingkungan, melibatkan policy. Mudah-mudahan pertemuan hari ini bisa membawa manfaat untuk kita semua. Saya kira demikian. Terima kasih.
Baik, Bu.
Saya kembalikan ke Pak Rian.
Ya,
Sehat selalu, jaga sehat, jaga
Amin.
semangat, dan jaga motivasi untuk semua
Amin.
mahasiswa. Ini termasuk yang tiga dari Universitas
dari
Permata, ada nggak?
Iya, ada Bu, ada tadi dinamain Permata gitu.
Oke,
Ada.
ya. Semoga
Tadi,
bisa mengambil pelajaran juga dari pertemuan hari ini. Terima
iya.
kasih.
Sama-sama.
Assalamualaikum warahmatullahi wabarakatuh.
Ya, terima kasih Bu Laili telah hadir dan juga mengundang Dr. Myra. Nanti kita akan ada sesi webinar lagi mungkin di awal November. Kita akan coba organize itu. Ya, kalau mungkin sedikit tambahan dari saya, perlu juga jadi untuk kita dan mahasiswa untuk tetap mengupdate informasi karena banyak hal tidak hanya secara teknis dari edukasi dan juga promosi kesehatan, tapi kita juga harus aware, harus memiliki knowledge yang luas kaitannya dengan bagaimana faktor religius tadi, agama ya, kultur, kemudian ekonomi dan juga politik dan lain sebagainya, karena itu menjadi hal-hal yang jadi pertimbangan untuk kita meramu sebuah pendidikan dan promosi kesehatan. Mungkin itu saja. Terima kasih. Kita cukupkan pertemuan atau video conference kita kali ini. Alhamdulillahirrabbilalamin. Saya tutup. Assalamualaikum warahmatullahi wabarakatuh. Oke, bye-bye semuanya.
Ya, waalaikumsalam warahmatullahi wabarakatuh. Next webinar, semoga tetap aktif ya.
Iya, bagus tadi, aktif banget.
Ya.
Terima kasih.